It is my pleasure to introduce you to Dr. Karen Raymer. Dr. Raymer has practiced anesthesia at Hamilton Health Sciences for 30 years. She has developed a broad range of interests in medical education at both the postgraduate and undergraduate levels. She was the program director of the anesthesia residency program from 2014 to 2018. She's the lead author of a popular anesthesia textbook for medical students. And from 2000 to 2006, she served as a Royal College examiner, including 2 years as vice chair of the examination board. Since then, her ongoing commitment to the preparation of senior residents for the oral exam has deepened her understanding of how learners translate clinical experience into performance in high-stakes oral examination assessments. She looks forward to sharing her experience with the broader community of learners, but also learning from them in return. Dr. Raymer developed our new Oracle course and is also the instructor. Thank you, Karen, and I'll hand it over to you.
Thanks so much, Christy. So in the next 20 minutes or so, I hope to cover the aspects indicated here, describing the rationale for developing the course, giving you an idea of what the course looks like. So the rationale for the course, I would say Canadian residents are generally highly successful at the Canadian licensing exam, largely because they are trained. First of all, they're trained well clinically, but also they're trained in the process of how to answer these questions that are delivered in a very structured format. And international graduates typically have not been as successful. And when I was an examiner, it was my impression that in a lot of cases, it was not necessarily related to clinical deficit, but just unfamiliarity with the process of the exam process itself. So it was my hope that by developing a course like this, it could level the playing field for international candidates and give them the opportunity to display their clinical expertise. The course is not specifically targeted to international graduates in any particular way. It would also be as useful for Canadian graduates. There's no element that is, as I said, is specific to international graduates, but those are the individuals that don't have necessarily have ready access to the intense exam training process that Canadian graduates have. On the Canadian front, there used to be a program called Making a Mark, which was sponsored by a pharmaceutical company that was an opportunity. It was in February of each year, I believe, and it was an opportunity for practice oral exam with not former examiners, but at least examiners that were unfamiliar to the residents. So they got the opportunity to really practice in that high stakes or a pseudo high stakes situation. That program is no longer in place, and it has left a bit of a gap for Canadian residents as well. So combination of those factors led us here at McMaster to develop this program. So what is the program like? Well, it's fully online, obviously, to enable people all over the world to participate. It is, I guess technically it's called asynchronous, but it really is synchronous in the sense that there are weekly sessions every Thursday evening, Eastern Standard Time, that are highly recommended. They're interactive, collaborative, weekly Zoom sessions, but most of the curriculum would be self-study and involve interactive discussions online throughout the week. The course is led, it's not self-study in the sense that there's no instructor. It's led by an instructor who is me, as well as other team members who would be involved in those weekly sessions. The time commitment would be about 4 to 5 hours per week, depending on how quickly you move through the material. You would receive a digital certificate of completion, which is shareable afterwards, but of course, most people taking this course are mostly interested in its applicability to promoting success at the actual Royal College exam. Enrollment is open to anybody, and Christy's going to talk about the enrollment process later. So what you're probably most interested in is what is the learning format and the course structure. So I'm going to spend most of the time talking about that. So the course is hosted on the online learning tool called Avenue to Learn, and this is sort of what it looks like over here. As I mentioned, it's 8 weeks, one module per week, and the modules sort of build on each other sequentially, where um, it moves in a stepwise fashion where you're building your ability to answer either more complex questions or working through the question as it progresses through the typical structure of the question. As such, there's multiple curriculum elements and multiple different ways that the curriculum is delivered. So when I talk about curriculum elements, I'll say there's probably 4 main strands of the curriculum, which I'm going to talk about in a little bit, and the multiple different learning techniques used, whether that's just course material, course content, reading the course material, working through quizzes, working through branching scenarios to challenge your decision making, interactive discussion assignments online, and of course, the live Zoom sessions, which will focus mostly on practice questions. And as mentioned, the sessions or the learning techniques are collaborative and interactive, but do involve a lot of self work through the curriculum. And as mentioned, each module is supported by a live session where any questions you have about what was presented in that module can be addressed, and ample time for practice questions, which is probably what most people are interested in the most. So when I talk about strands, the main sort of content strand, I would say, is examsmanship, how to actually translate your knowledge and clinical experience into a coherent verbal declaration. That is the examsmanship skill. Of course, there are 3, I would call, minor strands that are presented, and they're all happening at the same time, moving through all 8 modules. So category exemplars. So each module will focus on a category of question that the Royal College may use, such as obstetrics, trauma, pediatrics, perioperative medicine. The categories may mirror quite closely what the Royal College uses. They do change them from time to time, but the questions always end up being sort of the same anyway. So each module will focus on one of 8 particular categories, and the examsmanship skills that are focused on in that module are exemplified through that category. The next strand I would call is considerations. So as you know, on the oral exam, it doesn't focus heavily on the very intense book knowledge that you may be focusing on for the written exam, but there is a body of knowledge that is required to be able to answer the question. And most of that focuses on considerations for various types of disease processes or types of surgery, patient categories, etc. So through the 8 modules, we'll walk you through clusters of considerations so that you can focus on those in a stepwise approach. We don't teach it. It's something you have to either know yourself or refresh yourself. But we provide a considerations library that has been created by one of our team members, and you can access that and make sure that you're reviewing that material. And then the third strand is practice guidelines. Again, this is not being taught. You're not going to want to spend time with us particularly teaching you this, but we provide a library of up-to-date practice guidelines that you can make sure that you're reviewing. So each of those is presented in chunks through those modules in kind of a coherent way. So what does that look like? This table is a bit busy, but just to give you an example of the content of each of the modules, Module 1 starts out with understanding the format of the Canadian exam. The category exemplar is specialty anesthesia, which would be neuro anesthesia, thoracic anesthesia, etc. Every module includes recorded video examples of questions being asked by an examiner, who is me, and answered by a candidate. So in each module, the topic, the category topic of those videos is whatever's in this column here. The consideration cluster for module 1 would be neurologic or neuromuscular, and you can see that there's some coherence between these strands that are presented in each module. And then in terms of the practice guidelines, I didn't really want to busy up the slide too much, but you can see that they will also be coherent, for example, traumatic brain injury guidelines, etc. As we move through each module, we're sort of marching through the progress of a typical question. So you start off usually being asked about assessment or considerations. So that's where the second module starts off. Oops, typo there, sorry. It lends itself mostly to perioperative medicine when we're assessing a patient, detailed assessment, and that's why the consideration cluster for module 2 is around cardiac and respiratory illness. As the question evolves, you have to be able to identify whether the patient is optimized, what are the conflicts inherent in that section, and what will your goals be. And so module 3 focuses on that. The examples that are given through the courseware and in the videos in module 3 are focused on obstetrics, as is the consideration cluster that is presented. So I won't carry on through this whole table, but it gives you an idea how things are presented in a chunking kind of stepwise fashion, and it builds on itself. So you're continuing to apply things that you've learned in previous modules as you develop more of an understanding of how to handle various situations that the question may present, including what usually is some sort of emergency situation at the end of a question. We also spend time talking about very common pitfalls that candidates can fall into, which I think is a very valuable thing as an examiner. We would see the same sort of major errors over and over. So we've dedicated a whole module to highlighting those in a very concrete way, and I'll show you a slide on that a little bit later. One of the questions in the exam currently focuses on communication skills and is a role-playing question. This is typically often quite poorly done by international graduates, just through lack of experience in this exam format. So we spend a good chunk of a module practicing that. And finally, talking about how to use memorized frameworks in a positive way rather than creating rote answers, which are not favorably viewed. So that gives you an idea of how these sort of 4 strands weave their way through the course. And I think the main takeaway is that things are presented in bite-sized packages, and yet build on each other, and hopefully spaced repetition of concepts that you can start to develop confidence with what your approach should be. So if that's the overall format, how is this learning supported in the modules themselves? So as I mentioned, each module has clear objectives that involve those strands. So for example, I think this at the top here is module 2. So you can see the objectives are going to be to know how to confidently address whether you're asked for considerations or assessment. And the outcomes also include being confident about strategies to use in perioperative medicine questions. That's the category strand, and also the considerations for the cluster of considerations that involves cardiac and respiratory conditions. So that would be a typical learning objective for, for a module. This one here in the middle panel talks about the module 3, I think, which is on optimization, goals, and conflicts. So it's got a few more outcomes because that's a little bit more of a meaty topic. So you're going to have courseware that's going to dive, that you're going to read full of examples. Okay, it's not just endless talking, but actual clinical examples that focus on those areas. And again, the clusters and the category exemplars, I should say. The last one I think talks about pitfalls. So that's module 6, talking about the classic pitfalls in any oral exam, high risk categories, pediatrics, obstetrics. So we'll give examples of typical scenarios where candidates can easily go awry. So that just gives you an example. Learning outcomes are very clearly defined. Most of what is provided online is the written content written by me, where you're going to read and learn. So full of examples. So this is the example of the pitfalls. You're going to learn as I said, very specific examples. For example, knowing ATLS like the back of your hand, but not recognizing when it's being conveyed to you in the clinical setting. So for example, the examiner will not say, the patient now is in VF, what would you do? You might easily be able to manage that, but instead they'll say, the oximeter trace goes flat and the blood pressure cuff is not cycling properly. What would you do? So how are ACLS situations presented so that you will recognize them when they're verbally cueing them? The sedation trap, for example, on the exam, when you're asked to provide sedation, it's a highly likely possibility that there may be a contraindication. So you really need to make sure that it's safe to provide sedation in that setting. So this content will provide, I think, 10 or 12 different kind of classic traps, as well as those involving pediatric and obstetrical settings that you will read through and that will get reinforced in various other ways throughout that module. So that's the courseware. Quiz material is not focused on MCQ type level detail. It's more focused on your the clinical acumen that you need to demonstrate. So for example, this question, it might be from the module that's on sort of trauma and resuscitation possibly, or the emergency situations. So it's giving you a scenario where this commonly would come up in an oral exam situation where you're presented with a clinical scenario of a patient who's got status asthmaticus, and you have to be able to recognize the features that actually indicate the patient is getting worse and may require more extreme intervention. So this is just one example of a quiz question. Most modules have sort of between 6 and 12 questions that involve clinical scenarios focused on decision making and clinical decision making, as opposed to, what is the pKa of lidocaine or something like that. Some modules also contain what we would call branching scenarios that provide you with a typical kind of conundrum that may appear on an oral exam question. And this is just an example of the obstetrical difficult airway. So it's kind of a choose your own adventure where you click through, and depending on what decision you make, the question will unfold in a different way. So these are all part of your courseware for the week that you would work through on your own. And then it's supported by the live session where we can talk about other things. Every module has recorded questions, usually 2 questions per module. I think the first module only has 1 question. So they're based on the exemplar for that module. And there's an example at the bottom of one of my colleagues being a candidate and answering the question. Each module will have discussion assignments where, again, very clinically focused, and you're going to work through your answer. You're going to post it. Other people will comment on your posting. So this panel at the top, I've given a number of scenarios, and I'm asking you to outline the conflicts and the goals for two scenarios, I guess, or at least post them for 2 scenarios, and then reply or give feedback on your colleagues' assignments that they've posted. So typical scenarios that you might encounter where there's very obviously embedded conflicts, because the key to answering a question successfully is really zeroing in on where is a potential landmine in this question, and how can I set a plan that will avoid it or at least mitigate it? So really priming your mind to see a clinical scenario and immediately hone in on those. So those are what these discussions are focusing on. Oops, sorry. I'm just going to close the chat because it's blocking me there. Okay, so this second panel is asking you to create scenarios where you will embed some conflicting considerations and your colleagues will consider those. And you're going to provide new material for your colleagues to analyze. So each module has discussions except for the 2 modules where there's an actual assignment for you. And the assignments occur in module 4 and 8 and involve you recording an answer to an oral exam question. So you'll be presented with a question in a sequential fashion. Most questions have kind of 3 segments. And so you'll get the first segment, you'll record your answer to that, then it'll open up the next segment and you'll record your answer to that. So you're doing it kind of live and no time to, think about it and record it later. You have to kind of do it in the moment, like the real exam. So module 4, I think, is just a shorter, only the first 2 segments of a question. And module 8, you'll record an entire question and these will be graded. And then finally, the material, of course, is supported by live sessions by Zoom. And as mentioned several times already, we'll either cover questions that have come up in the module or do practice questions. And, you'll get an opportunity to get feedback and get through the nerves of answering question in front of other people too. So the schedule this fall is 8 weeks starting October 20th. The modules run from Monday to Sunday. The session is on Thursday. So it's pretty basic. I will say the timing turns out to be a bit awkward in terms of the written exam results reveal. So I've had some questions about, well, what if I unfortunately end up failing the written exam? I don't want to take the this oral course if I haven't even passed the written. So we will work in the future to time things so that won't be an issue. But for this session, if you register and then find out that unfortunately you were not successful at the written exam, then you can receive a refund for the course with proof, obviously, of that unfortunate outcome, which of course nobody is hoping for. So Christy's going to talk about registration, so I will just pass that over. And thanks for your attention.
So the first step is to go to our main website, which is continuing.mcmaster.ca. You will go to our Find Programs and Courses. We are under the Health and Social Service cluster. From there, scroll down and choose the Oracle course. There's lots of good information on this website as well about everything that we are talking about today. Go to the schedule page. Click on the fall offering. Click on the course tile for that section for October. Oh, I've already added it to my cart. I was practicing. Usually it will say add to cart. You would click there. You would then go to your cart. And then proceed to checkout. And that's as far as I can take you, but it will then walk you through step by step how to register in our system. And that's it. General way to contact Continue Education, if let's say, for example, you're in the middle of registering and you have a question, what happens when I actually press this? You can contact us through our main McMaster account, and we have a team of information specialists who are there to help you with more general questions. And if you get us through any one of those, we are happy to redirect you to the right person. Wonderful. Thank you for joining us. Have a great day.
Thanks, everyone.